We all know someone or have heard of celebrities who have a diastema, that characteristic gap between two teeth. Some embrace it as their style and don't want to close it, but many others don't like how it looks and come to us for solutions. In this video, we'll see what options exist today to close a gap between teeth, and we'll look at their pros and cons, like cost, time, and which one is the least aggressive for your teeth. Let's check it out. Diastemas usually occur between the upper central teeth, but some people have them between the canines and premolars, or in the lower teeth as well. It's rare to see it between the molars. The most common causes for a diastema are 1. The size of the teeth. This happens when there's extra space in the patient's jaws, because there's a large jawbone and small teeth. 2. Habits like thumb sucking, excessive pacifier use, using toothpicks, pipes, cigarettes, or pens and pencils, and one of the most common ones, the tongue habit. What happens is the tongue is constantly pushing against the upper teeth. Number 3, when there's a frenum between the teeth that prevents them from closing naturally. The frenum is a rigid mucosal tissue that gets in between the teeth. 4. Dental malposition, in other words, crooked teeth. Pay attention here, diastemas in children are normal. In fact, it's the ideal situation. If your son or daughter doesn't have gaps between their baby teeth, it's likely the permanent teeth won't have enough room to come in, and they'll need to see a pediatric dentist. Getting back to diastemas in adults, how can that gap be closed? The treatment depends a lot on which teeth are separated and, of course, the source of the problem. As I always tell you in all my videos, the first thing that must be treated in a patient is what caused the problem in the first place. If the cause is a frenum, before trying to close that gap, a frenectomy must be performed, which means cutting that frenum and removing it to then be able to close that gap. This procedure is usually done by periodontists and is a common outpatient treatment with a quick recovery. If the cause is some habit, of course we have to eliminate those habits before we can think about closing these gaps. Once the cause of the problem is detected and eliminated, we proceed to close the gap. And now, what options do we have? I'm going to list the options from the most conservative to the most aggressive, and we'll look at their pros and cons. The first option is orthodontics. Its advantages: braces are the least aggressive option, where the teeth are respected and practically nothing is damaged. They tend to be the most common option, but to get a great result, it's necessary to calculate the bite perfectly so they don't open up again. If done correctly and retainers are used, teeth can stay in their position for many years. Disadvantages: it's a treatment that needs to be done by a specialist due to its complexity, and thus the cost is high. Normally, a long period of time is required to complete the treatment. When treatment is done too quickly and braces are removed early, sometimes the gap opens up again. That's why it's vital to give teeth enough time to settle into the new position, as well as ensuring a correct bite and using retainers, whether fixed or removable. The second option is dental resins. What advantages do these have? It's a very conservative treatment and it's much faster than orthodontics. These are quite effective because in a single appointment, patients can leave the office without their gap. The cost is moderate and the procedure can be performed by a general dentist. The disadvantages they have is that resins are only effective when the patient's bite is not very aggressive. If the bite and lateral movements aren't well calculated, which are the movements when we slide the jaw to the sides and forward, the resins can fall off. This treatment isn't for many years, as resins tend to change color or fracture over time. The third option is dental veneers or crowns. The advantages are clear. Aesthetically, they're very good, far superior to dental resins. In terms of durability, they stay in the mouth for about 5 to 15 years, depending on use, and of course, if they were correctly crafted by the dentist and by the dental technician. In price, they're between resins and orthodontics, approximately. As for disadvantages, the main one is that dental veneers or crowns require tooth reduction. Although they last much longer than resins, patients must be careful when chewing and with their habits, as they can risk breaking. Another disadvantage is that not all cases can be solved with veneers, because if the gap is too wide, the teeth look very disproportionate, making use of braces, the only resource in these cases. There's a fourth option, which is a porcelain veneer without reducing the tooth. They're called porcelain chips, and they work very well. In my opinion, one of the best options because they offer more durability than resins, better aesthetics, and very little or no tooth reduction. These last three treatments can be done by a general dentist and preferably a prosthodontist. As you can see, friends, there are many ways to treat a dental bap. The idea is to go to a trusted dentist who will tell you what's best for you. Sometimes options are limited and we have to be open to complex treatments. If you have doubts about how you'd look, you can ask your dentist to perform a digital smile design or a mock-up directly in the mouth to be able to estimate how you'll look with the new resins, veneers, or crowns. If you have any questions, leave them in the comments. Don't forget to subscribe to keep watching videos like this. It's free and it can benefit your health a lot. See you in the next video, and I hope you're doing very, very well.